Hello, I'm Dr. Eric Mazer. Today's Ask the Expert question is, should I tell my primary care physician if I'm experiencing depression or anxiety? That's a really important question. The answer is yes. We're going to have an expert on the set, Dr. Khushali Shah. She is a primary care physician. And should patients talk to you about their depression and anxiety, and why?
Definitely, most definitely. I want them to reach out if they feel that there's something out of the ordinary happening with themselves. So, if they feel like they don't have interest in things or energy, or, have thoughts of hurting themselves, they should definitely reach out to their primary care provider or even call 911 if that's the case. But, it's...
Because help is available.
There's
They're
so much help.
There's so many things we can do to help that.
Exactly. There's suicide prevention hotlines, 911's always there. There's so many things we can do to help that, it doesn't, you don't have to suffer by yourself.
Yeah. And suffering doesn't make you stronger. I think there's an old sort of cultural thing. I've got to, buck up and face this and work your way through it. But this is truly an illness. It's a chemical imbalance in the brain, and it can be very effectively treated.
Exactly.
You're starting with some simple things.
Exactly. So you can, something as simple as meditation at home for 10 minutes a day can make such a big difference if you do it over several months. And if you're hesitant to take a medication, there's always things like therapy that you can go to that has really helped a lot of patients. And if those things don't work, we always have medications to fall back on.
And a lot of those medicines, this is not a whole new generation of medicines we have today compared to 20 years ago. And they're effective, and they have few side effects, and you can stop them when you're ready to stop them.
Exactly.
And reinstitute them. It's really, you just shouldn't suffer. And certainly, you worry about suicide. That is so prevalent in our society and so preventable, it is a tragedy.
Exactly.
It's truly a running tragedy. So,
definitely.
And the first person is your primary care physician.
Definitely.
This is part of your expertise, is it not?
Definitely. So every time a patient comes into our office, we screen them for depression. That's actually the new guideline now. So finding out, picking out patients with depression has been relatively simpler, but the first step is definitely bringing it up.
And so you don't have to go to a psychiatrist, well, you can.
Yeah.
There's no stigma associated with it. Do not suffer. And thank you. Thank you for such important information. Remember to share your questions and comments with us. Just call Community Relations at Nuvance Health at 203-852-2250. We'll see you next time.